I am Dr. Scharukh Jalisi, Medical Director at Doctors Express Watertown, located at 376 Arsenal Street in Watertown, Massachusetts. I'm an ear, nose, and throat physician specializing in the management of upper respiratory tract illnesses such as influenza. Today we will be talking about the flu vaccine and the influenza season. The flu season lasts from late fall to early spring. It afflicts people of all ages. 90% of the deaths in the United States occur in people who are over 65 years who suffer from influenza. The influenza can cause symptoms as minor as a cough and cold to serious conditions resulting in hospitalization or even death. The symptoms of flu can range from fever, cough, cold, headaches, body aches, and diarrhea. Diarrhea is more common in children, but it can happen in adults as well. It is important to know that a lack of fever does not mean that you do not have the flu or the influenza. Flu is spread by patient-to-patient contact or body contact. Schools, daycare, workplace environments are classic places where the flu can spread with ease. A typical viral illness will last for about a week, and if you have symptoms beyond that time, you want to have yourself evaluated. If you want to prevent influenza, the best way is avoidance. If you cannot do that by staying away from someone who has a cough or the runny nose, then personal hygiene is very important. Washing your hands with soap and water or with alcohol-based hand sanitizer is very important. In certain countries like Japan, people may wear masks to prevent the spread of the germs to going to other people or for them catching germs from other individuals. Currently, the Center for Disease Control releases vaccines every year to protect us from the influenza. These vaccines help build our own immunity. There are two types of vaccines. One is a trivalent vaccine that covers the three most common viral strains, and a quadrivalent vaccine that covers 4 viral strains. There is no difference in which vaccine you receive per the Center for Disease Control. Anyone over the age of 6 months should receive the influenza vaccine, with particular emphasis on individuals who are less than 5 years old or greater than 65 years old, because these age groups are highly susceptible to the complications of influenza or the flu. If you want to get a flu vaccine, you should go to your local primary care doctor or come to Doctors Express Watertown, where we can administer you a flu vaccine. There are certain individuals who should not get a flu vaccine, and these are those that have a severe allergy to eggs, since this vaccine is made in eggs, or those who have certain neurological conditions. Again, it is very important to discuss this prior to getting your flu vaccine with your healthcare provider. If you do think you have influenza and your viral symptoms are not going away, then you should see your primary care doctor or come into Doctors Express Watertown, where we can evaluate you. We can even do tests to check if you have influenza or not and give you appropriate therapy. The bottom line is, the more people in the community get the flu vaccine, the less the chance of spread of flu in our community. So get vaccinated, stay healthy. Thank you very much.